everyone. I'm Lauren. I'm one of the physician assistants here at Pennsylvania Pain and Spine. Today I wanted to talk a little bit about one of the most common questions we get asked by patients, whether it's in the office or they're calling in before a new patient visit or in between visits. And that's going to be about lead times between appointments. So again, whether you're a new patient that's being set up for an injection or it's after a procedure and you're coming in for a follow-up, or just, whatever your treatment plan is, it's unique to each patient. And we make, as providers, recommendations based on when we think, you should be coming back and for what. And there's a couple different things that go into that. It's not just a general number based on, some very objective things. It's a very subjective topic that we come up with based on your treatment plan. So a couple things that go into it as a provider, and then also talking with your other treatment team. Again, whether you're seeing a physician for procedures or have seen one of the other members in our team here, we all kind of work together, and that's our big thing that we pride ourselves on is continuity of care, comprehensive care. So that plays a role into, when we tell you to come back for your appointment, whether it's a follow-up, a procedure, or a couple other things that we do offer. And that's because we need time to, as providers, we need time to assess, how much time should we be giving your treatment plan? And what should be the next step from here? And as a dialogue between patients and providers while you're in the office, we go over that, but there's a lot more that goes into it behind the scenes so that we can really come up with the best plan for you. Because again, every patient is very unique to that. So whether it's talking with the other providers or just, doing a little bit more delving into your history, what you've had done, what you haven't done, and really solidifying that plan, that's where it comes in on our end, where we make a recommendation for when to come back. So again, it's not just a set number based on these extraneous things. It's really tailored to what makes sense for your plan. And we kind of go over that and we'll see, what you feel comfortable with as a patient and what we feel comfortable with as a provider so that we're all involved here. Another thing that goes into it is if it's injections, procedures, or medications that we're implementing into your treatment plan, which is again, very tailored towards you, and we'll go over in the office. A lot of times these things take time to work and we need to give it that due diligence and allow it to really gain traction so that we can go ahead and make sure that we're giving it time. So that when you come back for that follow-up, whether it's 3 weeks, 4 weeks, give or take, based on that specific plan, then we can really give it some time to say, okay, you know what, we did give it that ample amount of time and it is not working, or maybe it is working, and that gives us more information too about what our next steps can be. So that's a really big point, because if you come in, sooner than that, it's not going to give us that ample amount of time to really be able to assess that. And that will hinder our ability to come up with the best plan for you. So, all that being said, of course, if there's something that comes up between your last appointment and your next upcoming appointment, you can always call the office with any concerns you might have. If you want to see if you'd be able to be seen sooner, and then we can kind of take a look and see if it would be appropriate to bring you in at that time. There are certainly expectations and certain situations when it would make sense for you to come in and be seen sooner. But it's also really important to understand that a lot of times we're treating chronic pain. And while our number one goal is always going to be to get you, I always say max results with minimum effort and minimum time into it. But of course, that looks different for every patient. And we need to kind of give that some time and respect that you might not see a change overnight, and that's okay. Obviously, we want to work to get you as comfortable as we can, as quick as we can. But sometimes these things do take time, and we need to be able to give it that. Now, if you are in a situation where you think you need to be seen sooner, obviously call our office. If it's something that happens, again, a lot of times we treat chronic pain or some acute pain, but not necessarily emergent pain. So if there is something that is concerning to you, while you can always call our office, a lot of times if it's that specific scenario, we're probably going to recommend you be seen a little bit more emergently than what we can offer. And that would be at, an urgent or emergency room setting. So, but that's very much, unique situations. Overall, we come up with those, couple weeks, a month, whatever it looks like for you, with all of these things in mind so that we can give everything time to take effect and give us more information as providers of what's working and what's not. And, your responsibility as the patient is going to be to pay attention to that in between that time. Are you noticing small differences or hopefully big differences? Are you not? And what things are going into it that are working and that are not? And that will all give us, the ability to treat you the best. One thing I do want to touch on, of course, that everyone hears about is that insurance can play a role into it too. And that's absolutely true. But as providers here, our number one goal is always going to be the patient. So whether insurance is going to be a little finicky with it and we need to take that into account, if there's something that we need to do as providers, we're going to do our best that we can to treat you. Now, there are requirements with insurance that we have to follow by, and again, that looks different for every patient, but that does play a role into some of it as well. So just something to keep in mind. And again, if you have any questions, you can always call the office. We have people who deal with insurance on a daily basis, so they can kind of help you a little bit with that as well. But overall, best take home is that we're here to help you, and we want to make sure that we're getting you the most efficient treatment plan as possible. And sometimes a really important ingredient to that is going to be time. So if you have any questions, we will always go over this at your visits. You can always call the office. So yeah, just to sign off, I'm Lauren. I'm a PA here, and we hope to see you soon.